wanted to turn your head towards that side. So I'm just going to scan your neck, which you will feel as something cold on top of the shoulder.
Okay.
Okay.
So you're 2 weeks or just 16 days from your surgery.
Yes.
Plaster cast has come off. You're about to get a new cast. What I wanted to talk about a little bit was your experience of having the nerve block and awake surgery. So firstly, tell me a little bit about what it was like having the block, what the process was.
Well, when the anaesthetist
Yeah,
put it in, I felt a bit of pressure on my shoulder,
yeah,
and it was a little bit uncomfortable, nothing unbearable.
yeah.
I was able to talk with the anaesthetist,
Mm-hmm.
and he was able to slow bits down, speed things up
Okay.
accordingly, and the nerve block side worked great. That numbness lasted for quite a long time after the surgery.
Mm-hmm.
So I was able, straight after the surgery, my family were able to come and see me
Yes.
without the consequence of you being drugged from a major operation.
Excellent.
So particularly my grandson,
Yes.
he's only ever known people going to hospital, old people, and
Yes.
obviously the consequences aren't good always. So it was good for him to see his granddad
Excellent.
straight after.
Yeah, good point actually. That's
Yeah,
reassurance for the family.
it was very reassuring for Charlie.
Yeah. And the next stage, obviously, once the block had worked, then you were wheeled into the operating room.
Yeah.
Take me through that process there.
I was obviously made comfortable, and preparations were made. Staff introduced themselves to me,
Yes.
which was good, because when I've had surgery on my knee before, you've already had the pre-med before you go in, and things are very hazy, so
Yeah.
it's quite good, and it was good being able to talk.
I got along with Durham Miners Gala if you actually.
I've never been.
Really good.
Oh,
Yeah,
is it?
it's on it.
Yeah.
It's an almost carnival-like atmosphere.
Oh, really?
Yeah, I mean, you don't have to be into the politics and all that stuff.
No,
No.
But the bands and everything, the march and all of that, it's great, honestly. I remember going as a kid.
Yeah.
I used to live in Durham.
Okay. And so obviously the operation was being carried out by myself.
Yes.
We chatted a little bit during it, but during the operation, did you feel any pain, any discomfort at all?
None whatsoever.
Okay.
The only thing I did feel
Yeah.
was you felt vibration when the bone was being removed.
Okay.
But that was for a few seconds really,
Yeah.
over the whole period of the operation,
Mm-hmm.
and I wouldn't say detracted.
Okay. Did that
From the
bother you very
experience.
much, that sense of vibration?
Not really.
No.
It may bother some,
Yeah.
but on the whole I would say no.
Okay. So when the operation was done, you were wheeled straight back to your room on the ward?
Yep.
Yeah.
The nurse helped, obviously my arm was still dead
Yeah.
to all intents and purposes, so the nurse helped me get changed into a t-shirt rather than the operation gown.
Yes.
Then I went to bed and
Yeah.
had tea,
Yeah.
just like normal.
So you could eat and drink
I
pretty
could,
much
I could
straight away?
eat and drink straight away, which
Yeah.
was great,
Excellent.
because obviously I'd had that period of fasting before,
Yes.
so I was able to eat and drink.
Excellent.
And again, the staff were very considerate and cooked my food basically for me,
Yeah.
because I only had one arm.
Yeah, absolutely. And then at some point the block wore off. What sort of time approximately did you start to feel
That
something?
was about 4 or 5 o'clock in the morning,
Okay.
and that did come back with some force.
Yeah.
There was a lot of pain,
Yeah.
but I would guess, and it is only a guess, that would be no more than if I'd had the normal operation once the anaesthetics wore off.
Yes.
I had some Oromorph and some codeine,
Mm-hmm.
and went back to sleep.
Yeah.
It was a bit of a troubled night,
Yeah.
and I would say for a couple of days after,
Yeah.
it was troubled.
Okay.
But so once the block wore off,
Yeah.
there was pain associated with it.
And in terms of other patients considering such a method of anesthesia, any suggestions or things you might say or to them or guidance for them?
I would recommend it as the number one way of going,
Mhm.
because I've been knocked out for knee surgery before
Mhm.
and other hand surgery
Mhm.
in the past, but I would recommend this because of the way you feel after the operation.
Okay.
The only thing I would say is if you feel the sensation of like when you remove the bone, if you can't handle that vibration, because although you can't feel it as a pain,
Yes.
you can feel the vibration through your body.
Yeah.
If you couldn't handle that for that few seconds, I'd maybe go for a sedation,
Okay.
a mild sedation.
Which can be done as well.
Yeah.
Okay, that's great. We've been talking today about awake surgery for hands and wrist problems. As a consultant hand surgeon, I'm very much for awake hand surgery, as it aids the recovery and also gives excellent pain relief in the recovering and rehabilitation phase. Many patients you've already have said about the benefits of being awake and that they can eat soon afterwards. They are able to see their family members soon afterwards without clouding of anesthetic drugs, and also they have no risk of the nausea and vomiting of general anesthesia that can sometimes happen. From my point of view, we've been doing this surgery as standard practice here at Woodlands Hospital for just over 2 years, and I have a team of consultant anaesthetists who work with me who are expert at this technique. For more information, please contact Woodlands Hospital if you are at all interested in having your hand and wrist operation done via awake surgery.